Without further ado, thank you everyone for coming together today. As you know, we have Dr. Marla Shapiro with us. As I've mentioned to you, Dr. Marla, this is a live virtual town hall meeting. It includes all of our 1,700 MPAC staff across the province of Ontario. I want to reiterate to all MPAC that all of our staff are safe, healthy, and resilient, and we have no confirmed cases of COVID-19. In order to keep our MPAC vibe alive, every other day we're hosting one of these live virtual town hall meetings to keep our MPAC staff engaged, informed, and connected. And today we're very grateful that you, Dr. Marla, are able to join us and help us navigate through what is fact and what is fiction. MPAC, we surveyed you earlier this week. We know you have lots of questions and we hope to get through as many as we can today. Dr. Marla, our questions are not only as professionals working at MPAC, but also as citizens. Dr. Marla is a familiar name for most of you. Her resume is posted on our intranet. She's a medical contributor, columnist, host. She's been at the front lines of this evolving situation. She's currently a professor in the Department of Family and Community Medicine at the University of Toronto. She's also seen on the CTV News channel and is a medical consultant for CTV's National News. You've also probably seen her on W5. She's a member of the Order of Canada for her contributions both as a family physician and a trusted source of health information. So as you can hear, Dr. Marla is more than qualified to answer all of our questions, which hopefully will help us navigate through this current situation. So Dr. Marla, as you know, I'm here in Pickering, and I believe you are in your home office. Is that correct?
I am in Toronto. This is true.
Excellent. So maybe you can give us a bit of an update on what has changed in the medical world in the last few days.
Oh my goodness, everything has changed and everything continues to be changing as more data evolves. So we recognize by watching other countries and what other country experiences have been that we're at the beginning of this, and as in most other countries where it's taken off exponentially, that's the big concern here, that our numbers will continue to escalate and that we will continue to see the evolving illness as we have now moved from the travel history now to community contact. So the concept of containment, which is what we were all focusing on in the beginning, to identify those cases, quarantine those cases, do contact tracing of who could have had an exposure. We've moved beyond that as we're now seeing, as I said, the community spread, which is why that concept of mitigation that you keep hearing everybody talking about, the social distancing, which we can talk a lot about through your questions, is what we're really focusing on right now.
Oh, that's a great point, because I think we all had a little bit of optimism, I think a few days ago when we only had 8 new cases, and since then it's been in the 20s, 30s, and 40s, and close to home for a lot of us. I mean, as I mentioned, we're right across Ontario, and in a lot of our communities, there's 1 or 2 cases popping up. So before we get any further on that, can you just tell us, what is COVID-19? Is it a flu? Is it a cold? How do you tell the difference? What are some of the things we should be looking for?
So COVID-19 is from a group of viruses called the coronavirus family. And coronaviruses as a group are not unknown to us. In fact, most of the colds that our children experience are mild coronaviruses. And that's something to keep in mind, because that may explain why we don't see as severe disease in children, because they've had exposure to lots of different types of coronavirus, and perhaps, and it's just theoretical, we don't really know, perhaps that exposure offers children some type of immunity where the disease does not present quite as severely. So having said that, this coronavirus, COVID-19, is a novel virus. Where did it start? We believe that it started in Chinese bats. And it's a combination of the fact that human behavior interacting with bats has become part of the issue. Bat caves, nobody visits a bat cave. Nobody's interested in visiting a bat cave. But if you take the bat out of its natural habitat and bring it to a wet market, where the bat is either live and probably quite traumatized and has fecal excrement and is releasing the virus, that virus then becomes exposed on a surface and you get transmission to humans. We have not seen any evidence of transmission pets to humans. I get asked that question, can my pet give it to me or can I give it to my pet? Typically, we are seeing this now, human to human transmission. So that is what COVID-19 is. It's the same family, for example, that we saw with SARS and that we saw with MERS, which is a Middle Eastern respiratory syndrome. So I hope that answers it for you.
Oh, that's really helpful. And following on your example with children, I'm sure everyone with children, that gives them a little bit of relief if it's something that they're a little bit more immune to it. But we have staff at MPAC that are pregnant, and there's a lot of questions out there about pregnancies. So what are some of the myths and what are the facts around if you're pregnant?
So it's again evolving information. Everybody is always concerned that exposure to a virus in pregnant women have always been seen as a higher risk group. We know, for example, that this is true with routine influenza. It is why we tell women that they must get the flu shot when they're pregnant. Women are afraid to get a flu shot when they're pregnant, but it's the best thing that you can do because you're protecting yourself and your unborn child. However, we have limited experience with pregnant women as this is a novel coronavirus. But what we have seen in the Chinese data and the data that's rolled ahead of us, we haven't seen fetal placental transfer or maternal fetal transfer, meaning mothers who were pregnant and got exposed to corona, gave birth to their babes, and their babes were not positive. There was one case, we believe that was exposure after the fact. So that's one thing. We haven't seen this group as necessarily being a high-risk group. But again, the virus hasn't been around long enough where we've seen exposure in the first trimester to know what the outcome will be. So right now we're considering pregnant women pretty much the same risk as everybody else or average risk. We are not seeing evidence yet that they are a high-risk group or that exposure has a fetal impact. But again, given the fact that we've been tracking this since January, we haven't seen women exposed in the first trimester yet. So we lack that data. We'll have to wait and see.
Okay, thank you for that. So we've heard a lot about social distancing. We've heard a lot about washing your hands and good hygiene, but what are some of the simplest and medically supported ways that we can all help stop spread this virus or catch it?
I've said this every night on the air, and I say it multiple times, and we're not going to stop saying it. We've moved now to a strategy of mitigation. Obviously, we're containing people who are diagnosed and they're being quarantined to their homes, or if they need ventilator support or hospital support in a hospital setting. But we've now, all of us, have moved to mitigation. Mitigation means we want to break the chain of transmission because often now we are seeing there are asymptomatic carriers that we get exposed to, and we're seeing people coming down with the disease where we don't know where the exposure was. The only way to mitigate against that is to have social isolation. And social isolation means for each and every one of us that we stop doing everything that is non-essential. So if we can work from home, we work from home. In my office, we've now moved to a telephone platform, the OTN, where patients can actually see me and I can see them, and we have a virtual appointment. We're doing everything as remote as we possibly can. So you're limiting where you go and when you go. So you're going to the grocery store because that is an essential service, or the pharmacy, and then you're coming home. Today I got asked a question. We came home 14 days ago. Our friends came home 14 days ago. We've both been home for 14 days. Can we have dinner at my home together tomorrow night? That's not social distancing. It's not an essential thing to do. So it's severe and it's tough and it's emotionally difficult, but we are really talking about the fact that social distancing is the greatest tool that we have right now.
No, that's great. And I know that that's what the government is confirming, and we're doing the same thing. So we have 27 offices across Ontario, but 90 to 95% of our people are working from home. We've left the offices open for staff only, not for the public, as a resource, but it accomplishes social distancing because there's less than 5% of people are in our offices. So we're doing our part. Maybe on that note, there's a lot of information out there. Is it droplet? Is it airborne? How long does it live on surfaces? What types of surfaces? I know it's still early days, but what do we know about this virus?
Let's talk about what we do know. So we know that it is droplet spread as opposed to aerosol. So what does that really mean? An aerosol means that when you sneeze, it can stay suspended and go a long distance. Because of the fact that it's droplet, that's why you hear about the 2-meter separation, because we typically know that a droplet doesn't go that far. It can stay suspended in the air probably for 30 minutes, maybe a little longer, and it probably can be viable for up to 3 hours. And then we talk about it landing on different surfaces. contaminating a surface. The medical word for that is a fomite, when you have an active substance that is alive on an inanimate object. And we've learned that the type of object that it is will probably determine the length of viability. So in other words, if you're on cardboard, probably you're looking at hours, which is why you don't have to be alarmed when packages are arriving at your home that you're going to touch a package and be exposed to COVID. On harder surfaces, we're seeing different estimates. We've heard estimates, for example, up to 9 days. More realistically, it may be 5 days on glass surfaces, but the bottom line is that it does stay alive on surfaces, which is why it's so important to disinfect your surfaces and to wash your hands after, for example, being on a subway or being in a place of public exposure. So COVID can't jump off an inanimate object into your face. The biggest issue we have is that we touch surfaces and then without even thinking about it, we rub our nose, we rub our eyes, and we have exposure to the virus, which then enters through what's called our mucous membranes. So through your nose, through your eyes, through your mouth. So it's that touch cycle that we're trying to break.
That's really helpful because I know a lot of people are moving to Amazon now. They're having groceries delivered. So if it only lives for a few hours, as you say, on cardboard, but for days on hard surfaces, that gives us a lot of really good information. On the topic of information, I know there's a lot of resources out there with the World Health Organization, but what about ones where we have questions about the virus or symptoms ourselves? Is it telehealth? What is the best way? Because I heard that doctors right now.
Please don't call telehealth. Telehealth is so overwhelmed right now that for simple questions that you have, you really want to leave telehealth to somebody who has no other access to medical information and really needs the medical information. Right now, it's taking days for telehealth to call you back. So we don't want to clog them down with calls that really don't need to happen. So lots of different websites. Health Canada has a website. The CDC has an excellent website as well. So lots of vetted sites for you to be getting your questions answered. The last thing I want you to do is just Google COVID. And if something just happens to pop up, that's not Health Canada or the CDC, the Center for Disease Control. You know, there's all types of misinformation out there. Someone sent me a video about how you can use your blow dryer to heat up your nostrils and that will kill the virus. Oh my goodness. It's just amazing. And a lot of charlatans out there right now trying, you know, horrifically to make money on this pandemic. So you really want to make sure that you're getting, you know, good information. Every day between 1 and 1:45, I'm on with Evan Solomon answering these questions. Every evening at 9 p.m. on News Channel, I'm there answering these questions because nothing is too repetitive. If you have it as a question, you want to answer it and you want to get, you know, the most reasonable information that we have because we don't have all the science at the present time.
Oh, that's helpful. Okay, so we won't overload telehealth. We'll post all of those websites on our dedicated COVID-19 intranet site so that all of our employees have them. And we'll tune in and listen to Dr. Marla. So definitely appreciate that. Are you hearing about mental health in this? Because now, like, we've had such a life change. We've gone from being very social beings, being able to go out for dinner, being able to go to the movies, and now we're working from home. We're afraid to go out. We're washing our hands and carrying hand sanitizers around. What are you hearing about our mental health in this current situation?
So we are very well aware and very concerned about mental health. First of all, for individuals who already have a pre-existing mental health illness, this definitely can make it more difficult, drive people to drink more, follow unhealthy habits. It's very worrisome. One of the things that I'm telling people, even though I'm part of the media, is don't watch us all day long. Don't just sit and focus on this 24 hours a day because it can fuel anxiety and anxiety can fuel panic and that can increase risk for mental health, be it anxiety or be it depression. So being socially isolated doesn't mean that you shouldn't have some type of social relationship with people. We know that people who are completely socially isolated are always at risk. So social connectedness is very important. So whether it's on virtual platforms like FaceTime or texting friends or speaking to friends, You know, I had a picture sent of a whole group of girlfriends. They got on a group chat and they were having a glass of wine at 6 o'clock in the evening together, chatting among each other. We have to be novel in how we can be socially connected, but take care of yourself, sleep, eat. You know, being in social isolation or social distancing as much as we can doesn't mean that you cannot go outside and go for a walk, keeping that sort of meter distance with people. You walk by people, you know, you can give them, you can sort of, you know, wave without giving them a hug and without touching, but get outside and get some fresh air. I think it's really important that we continue to do that. Try and exercise at home if you can. Take time to do things that give you pleasure. If it's reading or if it's baking or whatever it is, remember that you have to take care of your mental well-being.
Oh, thank you for that. So we're all going to get outside. And I know that a lot of organizations are offering now free virtual fitness classes. So I know Good Life has come out with free virtual fitness classes. I believe yoga studios are doing the same thing. And we're going to post those as well on our dedicated intranet page. But you're right about the media. It's all over the media. And when you and I spoke on Wednesday, you said to me that one of the hot topics emerging, and I hadn't heard it yet, was anti-inflammatories such as ibuprofen and Aleve. And then I went home that night and there it was on the news. So what is the controversy there and what should we know?
So the controversy there is that out of France, the health minister tweeted something about the use of Aleve and COVID, or Advil and COVID, or anti-inflammatories and COVID as causing an increased risk to the disease. So this is just not scientifically founded. This is, you know, talking about things as getting a life of its own, right? It becomes a tweet that gets retweeted and retweeted and goes viral, and then it becomes fact. It is not fact. This morning I was speaking to my other colleagues, going through all of the organizations, the World Health Organization, all over infectious disease organizations, saying that there is absolutely no scientific evidence that there is a relationship between anti-inflammatory use and COVID. So, you know, I'm not sure how these things continue to grow other than through tweeting and through going viral and people assuming that what they read is correct. It's not. So we don't see that relationship. If you prefer to use an acetaminophen product, then that's fine, but certainly not because the data is saying that there's a link. One other one that I want to bring up that's really, really important. Now the type of same virtual craziness that's going around is the relationship between a group of antihypertensive medications that are called ACE inhibitors or ARB. These two different classes of medication are very commonly used for blood pressure control. So ramipril, candesartan, irbesartan. So for those of you who have high blood pressure within this audience, who are on blood pressure medication, if you have not read, at some point you likely will read the notion that the use of these drugs as well will increase morbidity, meaning illness, or mortality, meaning death, if you get COVID. Again, we think this came from the fact that we've been talking about the fact that we know that COVID joins into the lung by connecting to the ACE receptor in the lung. So somehow somebody made the connection that using an ACE inhibitor, which is what we use for blood pressure control, or an ARB, which is another class of medication, which works similarly, that will somehow impact receptors and increase your risk for COVID. What we are seeing is that individuals with hypertension as a comorbidity who get COVID do poorly. They're more likely to do poorly than somebody without that as a comorbidity, meaning an illness that already exists. That's what the word comorbidity means. Co meaning along with, and morbidity meaning something that makes you morbid or ill. Hypertension is considered a comorbidity. You certainly do not want to stop taking your blood pressure medications and have uncontrolled hypertension, which is far more of a risk factor than some notion that there may be a relationship between these two medications and the risk of COVID. Again, American Heart Association, the Canadian Cardiac Society, all of them saying no data to support this rumor. And please do not stop your medication without at least speaking to your healthcare giver, recognizing that hypertension untreated is far more of a concern than anything else.
Oh, that's really helpful. And this is exactly why we wanted to talk to you, because there is so much out there and we want to get in between the fact versus fiction. So what I've heard so far is it's early days. That it doesn't sound like there has been any proven medications that are out there that are making this virus worse. So the most important thing, would it be to just keep yourself healthy and keep your immune system up? And as you say, eat well and exercise and get outside, but don't make any changes to your regular medications. Would that be your advice as of now?
Absolutely. I mean, it sounds so trite to say, oh, you've got to eat well, but it's just so true. That advice doesn't change. It really is important for you to be doing what you need to do to nurture your body and nurture your mind. Really important. So we can't stress it enough, right?
Absolutely. How do you think we are as a country being prepared? Do you think that we're better prepared than some of the other countries? We've all read in the news, Italy, the US, China. How do you think we're doing?
So I think we have the benefit of knowing what's happened in the other countries, right? We've seen what's happened in Italy. We've seen what's happened in Korea. We now are seeing the news that there are no new cases in China, which are reassuring. So we are well aware of what these countries have been through and what likely is going to happen to us. So I think knowing that, it has ramped up our preparedness. So we're learning from those countries. But if this continues, let's say at an attack rate of 40% of the population, some are predicting 60% of the population. And if you look at a mortality of somewhere of 1 to 2%, which is probably more in keeping than the 3% that we've seen, that still means if this went unchecked for a year, this would be the leading cause of death in all age groups. So we know that making us do whatever we can to break, we keep saying damping down the curve is critical because we don't have enough hospital beds. We don't have enough ventilators. That's the fact, not anything that should send us into frenzy mode. And we've got a national stockpile, as does the United States. But if we don't do our part through the social distancing to break the chain of transmission, this could be catastrophic. And I hate to say that, but the reality is that we need to do what we can do to change that potential as an outcome.
Yeah, no, it's scary to hear, but you're right. Everyone has to do our part, and that's what we're trying to do. And I think that's why you have to make the messages so scary, just to make sure
I think
that
it's so
everyone
impressive. When I got the request to do this for you guys, I thought, wow, like what an unbelievable organization that's attending to the physical health and the mental health of its patients, of your community of workers, by having them socially distanced in terms of where they're working and how they're getting their work done, maintaining their employment, and at the same time getting valid information to stop this chain of misinformation that happens under really unprecedented situation. We've never seen a situation like this. I covered SARS as well. SARS was not like this. And if you think back to SARS, did any of you have that sense that you do now? Because everybody I speak to now is sitting, under a control of, most being quite anxious. We didn't see this with SARS. But given the worldwide nature, the fact that this is a pandemic, everybody's feeling different. I also just want to point out one thing. Pandemic is just a descriptor that means it's happening at the same time globally. Once something becomes a pandemic, it doesn't mean that the nature of the disease has changed. It just means the location of the diseases have changed.
Okay, no, that's helpful to know, because I think you hear the word pandemic and it almost creates panic. But you're right.
Of course it does.
I was just reminding a few people today, we're only on day 5. So we started really communicating and changing all of our processes mid last week. But over the weekend, we came out with a directive that said we strongly encourage everybody work from home as of Monday morning. And by day 2, day 3, we were all going through different challenges, myself included, working out the kinks. And now by day 5, the new normal feels a little bit more normal. There's still kinks, but it's a change. Like, we're used to coming into the office every day, and now we're working out of our home offices. And one of the reasons why we want to do these virtual meetings is we need to stay connected, we need to stay informed, and we need to stay engaged. And I have many staff across the province just say thank you, because they feel like they're part of something bigger, and they're not being lost out there and only communicating through a computer and through a telephone. So this helps keep the conversation going.
Last night when we did News Channel, and we're doing it again tonight, and we're going to do the same thing tonight because we got so many emails thanking us for doing this. We actually had some kids send in their questions. So, we forget that our kids are hearing a lot of this, right? They're hearing a lot of this. We don't leave their mops. They just and sponges, and they just sponge it all in there. And who knows how they're processing it. So we have to remember, for those of us who have children, we want to do whatever we can to talk to them about this, right? So some of the questions that we got from kids last night was, when can I see my grandparents again? Or why can't I see my grandparents again? Or why can't I go to the park? Or why can't I play hockey? Why am I at home? Like, these are questions our kids have. So it's important, and we thought, let's answer these questions for kids, because they're important. They're as important as the adult question. And to be able to explain it in a way that doesn't panic them, this is pretty scary stuff if you're 7 or 8 or 9 or 10 years old or 5 years old or whatever age group you are, a teenager. And we saw that horrific footage, spring break, with that cavalier sort of, I don't know if you've all seen it, lots of kids at spring break saying they don't care, and if they get it, it's going to be okay, and not social distancing at all. Talk about not getting the message out.
Wow, that's excellent. We're going to try and find that clip, and we'll get that posted. There's another fact versus fiction maybe you can help us with, and that is it climate driven, or can it be anywhere? Like, do you have to be in a warm climate, cold climate?
It's such a good question, Nicole. I wish I had the answer to this. So the optimistic answer is that we see seasonality with almost all our influenzas. So in other words, as our season is ramping up, Australia is ramping down, because when it's our winter, it's their summer. And we typically saw that with the even the Spanish flu. We saw that it got less in the summer. However, it ramped back up in the fall. We don't know whether or not this will be a virus, since it's novel, that will behave that type of seasonality. It would be nice if it did, to gear us up for what might be a worsening of the situation come the fall. But in terms of what we're seeing in Australia right now, we haven't seen that type of behavior. We haven't seen that just on the basis of warmer weather, they're not having disease. So the answer basically is, we do not know, but we are not making the assumption that this is a weather-related event. We just don't know. We'll have to. It would be great if it was. And don't forget that as we're really ramping up our mitigation and social isolation, we happen to be in spring as well. So if we're effective with this, it'll likely be we're effective because we've all done what we need to do, and not just weather.
Okay, that's helpful. Thank you. Another bit of information that's out there, I almost feel unfair asking you these questions because I know it's all still early days, but now you're hearing about malaria medication being used to help it. There's all these trials on vaccines. Like, what can you tell us about things that are out there and what's actually true?
So there are trials on vaccines, but it's going to be a year until we see a vaccine. You cannot just have a thought that this is going to work and start putting it into people's arms, because in fact there may be unanticipated adverse events. We cannot fly without science. We absolutely need science. So the fastest that we're going to see a vaccine up and running and to market would likely be a year. So we're letting our researchers worldwide, everybody is working together. It's terrific, but not yet. Now, when it comes to hydroxychloroquine, which is an anti-malarial drug, there was a study that has been published, again, small numbers, where the use of hydroxychloroquine along with an antibiotic called azithromycin seemed to make a difference. And certainly for patients in hospital that are ill, among a cocktail of medication that is being tried, hydroxychloroquine is one of them. But there is no evidence that if you start taking hydroxychloroquine or this antibiotic, that it's going to prophylax or prevent you from getting this. So again, interesting information. The data is now being shared very quickly worldwide for everybody to share the data and learn from each other. But when you hear something like this, that doesn't mean that you're running to get a prescription for hydroxychloroquine to stockpile this because you think this is something that you need. So it might be efficacious. It's certainly not a cure. In terms of the data that we're seeing, it may shorten viral shedding. We're not really sure. Again, early days, and this is data that you're hearing that we're being respectful of, but again, small numbers.
No, I appreciate that. I read that article myself, so it has gone viral, and it's good to set expectations. If it's going to be a year for the vaccine, we should all be have that in our heads. Otherwise, we think it might come out sooner. The other bit, and I'm not sure if there's any information about this yet, but sometimes they say when you get the flu, you won't get it again. You build up an immunity. Is there any data now on anyone who's had COVID-19 that they could possibly get it again?
A very common question that we're getting asked right now. So again, we don't know. We haven't seen that, to be honest, we haven't seen that happening. There's no reason to believe that you're not going to get immunity. Look, when you get measles once, you get your antibodies to measles, you don't get measles again. And the reason that we see influenza come back every year is because influenza mutates and changes. And if it changes in ways that are significant enough that you don't have immunity from your previous episode of influenza or the previous flu shot. Likely COVID is going through small mutations. That's the nature of what viruses do. They mutate as they go along, but we haven't seen any evidence of that type of significant mutation that is actually presenting as if it's another new novel COVID. So we believe that having had the disease, you likely will be protected from the strain that we see circulating now.
Okay, great. Another question that's going out there is UV light on surfaces and if that makes a difference with spreading of the virus.
Soap and water, Lysol disinfectant, 4 tablespoons of bleach in a gallon of water. No, I mean, you just save your money and not buy these ridiculous things that are out there. We know that soap and water is kryptonite to the virus. We've got a really easy thing here, just wash your hands. And it's far better, by the way, to wash your hands with soap and water than it is for you to be using a Purell or an alcohol-based sanitizer. If you're using a sanitizer because you don't have soap and water, absolutely by all means, and read the bottle, it should be somewhere between 60 to 90% alcohol-based. But soap and water is excellent. One of the kids asked us yesterday, it was very sweet, how do I know that I've washed my hands long enough? And the answer is that you probably know how to sing happy birthday to you. So the entire time you're washing your hands, you sing happy birthday to you. And by the time you're done singing the song, that means you've washed your hands long enough.
Long enough, yeah. Oh, that's very cute. Here's another question that comes up all the time. People have symptoms. They want to get tested. Should they get tested? Should they go to a hospital or one of these testing clinics? What's your advice?
I bet you know the answer to that. So we do, as much as we think that testing is so critical, we are not testing people that don't meet the criteria. What we're saying to people is that if you have evidence of a flu-like illness and you're under the age of 60 and you don't have fever and you don't have other significant illnesses and, you just got a bad flu, like you feel terrible, want to stay in bed, you do that. You socially isolate for 14 days, you keep yourself away from your other family members, and you don't get tested. When do you get tested? If you're, we've removed the travel because we're now seeing travel is not, as the identifier as it was at the beginning. If you're over the age of 60 and you have an underlying illness and you have fever and you have respiratory distress. Now, if you have respiratory distress, you take yourself off to an emergency room. But if you're not with respiratory distress, but quite ill, 60, fever, and an underlying comorbidity, then you likely should get tested. But if you've got a mild flu-like illness or even a moderate flu-like illness, we're likely not going to test you because, to be frank, we don't have enough tests to test the entire Canadian population. So we want to be very strategic about who gets tested.
No, and that's helpful because, again, that's doing our part. And I think a lot of people now, they're getting a common cold or flu and they're wondering, do I need to get tested? Could I have been exposed? Because as you said, now we're getting this community sharing of the disease, or the virus. What about a second or third wave? I mean, one of the things the government came out and they said, they're closing obviously it's March break this week, the next 2 weeks are also closed. So we're on this April 6th. April 6th is this magic date. Do you think this is going to go past April 6th, a lot of these measures of social distancing? Do we think there's going to be a second or third wave? And we talked about the government's put all these measures, as have we, on the April 6th deadline. Do we think this is going to continue past April 6th? What are some of your predictions?
I hate to say I think it's going to continue, but I think it's going to continue. I think that we're doing significantly really important work right now in getting that message out. I mean, a lot of people were not social distancing. A lot of people feel this doesn't apply to me. I'm not going to get COVID. I can go about my daily business. I think the longer this goes on, the more people are getting the importance of the fact that we have so much power as a society to protect ourselves and to protect those around us. I hope by April 6th, it's going to be time to submerge slowly, but I don't know. And I think that basically what I'm saying to everybody, because people keep saying to me, when is it going to be normal again? And I think that's really what you're asking me, is this going to go past April 6th? I think what we're saying is that this is our new normal, and every day will predict what we do tomorrow. So let's not even ask that question about April 6th, because I think it drives panic. You know, oh my God, it's only March 20th or March 21st, and is this ever going to be done? I think that we are going to play it day by day, and I'm not saying something to myself like, oh, March 6th, everything's going to go back to normal, my office is going to be fine, people are going to be running in again. I'm just saying, let's see what tomorrow brings, and we'll adapt. And we're an adaptable society, and I think remove that pressure off you in terms of looking for an anticipated, it's going to be done by date, so that if that doesn't happen, you then feel completely overwhelmed by that. So let's stay in the moment. I think that that's the best moment to be in.
No, that's great advice. It's almost like setting our expectations. The vaccine's not going to be here in a couple of weeks. It's going to take a year. I think your advice is great. Take each day as it comes and embrace the situation and try and be resilient and flexible and agile. And we consider ourselves an agile organization, and we're at the ultimate test of it right now.
Nicole, that word resilient, I want everybody to stop for a second and think about that word resilient. What does resilient mean? Resiliency is something that I think innately we have. It's the ability to adapt under changing circumstances. And we all need to reach in and find our resiliency. And if you as a community of workers know each other and you know that someone's having a difficult time, reach into your resiliency and do what you can to support them, albeit socially distant. But, send a text, pick up the phone, call your friend, do those things that you normally do. Socially isolate doesn't mean lose your social connectedness, because if you lose the social connectedness, you're going to lose the resiliency. And we really need to rely on our resiliency right now to get through this.
Oh, that's excellent advice. And from an operational standpoint, one thing that we've said with all of our staff is our business is continuing, but we're doing it differently. So we are a public-facing organization. We are dealing with stakeholders. We're dealing with property owners. And right now, we're not doing that. So we're in our analytics phase. We're doing everything virtual. Oh, you're back on the screen. I don't know if you can see us.
I'm not quite sure what happened, but it's so good to see you all.
It's great to see you.
See, we're resilient. Eventually it did work, right?
Resilient.
There's resiliency in most.
We could have pre-recorded this, but live is more fun because you just don't know what's actually going to happen.
Well, exactly. It's like live television. You never know what the heck's going to happen, but we just go with it. So thank you there you are. So good to see you.
I have two last questions for you, and I really appreciate this. This has been amazing. What advice do you have for us, both as professionals and people in all of this? I know a lot of it's embedded in there, and we just talked about resiliency, but if you wanted us to leave with a lasting message, what would that be?
Okay, so you're walking on the street, and there's a hole in the ground, and you see someone has fallen in the hole in the ground, and they're just so distressed, and oh my God, I'm in the hole, and I can't get out of the hole, and I don't know what to do to get in the hole, and you jump in the hole with them. Now we got, oh my God, there's two of us in the hole, we're never going to get out of the hole, and we're stuck in the hole, and okay, let's start again. You walk by, there's somebody in the hole, and they're just so distressed, I'm in the hole. Go get a rope. Offer them the rope. Give them the opportunity to pull themselves up through the rope and get out of the hole. And it's visual, but it's also emotional. And I think that's what we need to be doing for each other right now. So don't commiserate. Like, let's sort of, if you're having a panic experience or an anxious moment because of the way that you're feeling, embrace it, okay? I know why I'm feeling this way, validate it, it's real for me, I feel short of breath, I feel panicked, I feel like I'm never gonna go back to normal. Okay, now take a deep breath. Now take a deep breath and say, I'm gonna give myself permission to take this and put it aside and no longer make this my reality. And I'm gonna focus on what's positive in my life right now, what I can be doing, the support of the community that I have. And I'm gonna keep thinking about how I can offer a rope as opposed to getting down in the hole. And what we can do right now to offer the rope to each other is to continue to do what we're doing in terms of social distancing. Yes, it's hard and it's no fun. I miss my colleagues every night, and going in to do the news as opposed to doing it from where I'm doing it here, you'll recognize the various parts of my room. Canada's seeing the interior of my home now. But that's what we need to do. We need to do that because we've made it a priority to get the news out there, but we've also made it a priority not to put each other at risk. So this will come to an end. Let's not focus on the when, let's focus on the how. And the how is what we are doing right now. And for that, I thank every one of you for being here today and for doing your part and trying to protect each other by protecting ourselves. And every time you socially distance, it's not just yourself that you're protecting all the other people that you're not seeing. And that's what's so critical.
I love that. And I see it as a call to action for all of us to do our part and do things differently and help support each other. So I love that message. So my final question to you, I'm a bit of an optimist. I think in every challenging situation, there's also an opportunity. What good is going to come out of this? The learnings, the developments, like there's got to be some good that you see down the road once we do get through this critical phase.
Oh, I think there's a lot of good that can come out of this. I think, first of all, as a country, we're getting educated about the importance of infectious disease. I hope one of the good things that comes out of it is next year I won't have to be twisting so many arms to get flu shots, regular flu shots. People should realize that influenza also is a worrisome disease. I think it's teaching us a lot about Canada as a nation and what we can do for each other. I'm hoping the message about hand washing will be one that persists with us, just as a general health and precaution that we can always do. But I think it will teach us that as a country, when we pull together and as a nation, we can not only survive this, but we can thrive through this. We can learn other ways to keep our businesses going. We can learn other ways to persist and get through, other ways to support our family members. So I think that we are learning as a nation, and I think we're all paying attention, and that's so important.
Oh, that's excellent. Thank you so much, Dr. Marla, and thank you everyone for joining. We've recorded this session. We're going to share it. We'll share it with you. I think everyone can learn from this session, professionals, citizens, Canadians. So I really appreciate it, and I know I feel more informed, and usually just being more informed helps reduce the anxiety. So thank you for that.
Knowledge is powerful. Knowledge is very, very powerful. But remember that false knowledge is very damaging. And remember that every day we're learning new information, so you've got to be fluid with the information you're getting. It's not that we're changing our mind, we're learning more every day. Nicole, I want to thank you and your organization for inviting me to be here. And I'm happy to come back and talk to you guys at any time. And thanks for putting through our technological transition. It worked in the end.
Excellent. Thanks for all the work you're doing in our community. So you be well, be safe, and everyone be well and be safe on the line. Thank you.
Thanks. Bye for now.